You have to be a teenager to get braces. This is a big one. There's a lot of confusion around this.
No, you don't have to wait till all your adult teeth come in to get braces. That's not fact. I wouldn't say braces, but orthodontic interventions can begin as early as even 4 or 5-year-olds, depending on what situation is, what the condition is. That does not always mean braces, does not always mean orthodontics has been so many times just linked with braces. But there are so many other things that are done to get your jaws ready and developed to make sure that they're ready for the adult teeth to come in.
Awesome. Well, welcome back, guys. Thank you so much for joining us with another episode of the Define Orthodontic Podcast. Today's a fun one. It's going to be a little shorter one, too. I'm Gunny, Sodhi, co-founder of Define Orthodontics. To my right is
Dr. Kirat Sodhi.
Awesome. Today, we're going to have a little bit of fun, okay? Because we always do conversations, but I think what we heard from our social media team was we want to do some myth-busting orthodontics. So what we want to do is I'm going to present you with a couple of, myths or facts, and I just kind of wanted to hear from you. Is it a myth? Is it a fact? And if it is a myth, can you dispel it a little bit? It's going to be quick, rapid fire. So this is round one. It's an easy warm-up. We're going to take it a little easy on you. So let's get started. Number one, braces fix more than crooked teeth. Myth or fact?
It's a fact.
Yes, absolutely.
Yeah, it's a fact. It fixes a lot of things. It's not just crooked teeth. It's like the healthy bite, occlusion, perio issues, interdisciplinary care. That's just dental. And then we talk about overall health. We talk about airways. We talk about space for our tongue. And then, of course, cannot ignore the social aspect of the mental, emotional aspect of it, fixing, the confidence, bringing out the best in the person.
Absolutely. Straighter teeth are easier to clean. Myth or fact?
It's a fact.
Absolutely.
Absolutely. You have straight teeth. It's easier to brush, floss. I've seen some really, really good patients who come in and they have great hygiene everywhere, but where you'll have the crowding, the overlap of the teeth, it's just like the foods get stuck. It makes it harder. Yep, it makes it harder.
This is a really nice one. I feel like this is every orthodontic office maybe should have a plaque on here about this one. Teeth shift back without a retainer. Myth or fact?
It's a fact.
Yeah,
yes.
Absolutely.
Our teeth, yes, we have, people ignore the fact that, the teeth are still bounded by the little periodontal fibers, and they will always try to, they're like stretched and pulled in the same direction. So even especially after the first year, after getting the braces off, if we're not wearing the retainers, the teeth will shift back.
100%. Ooh, I love this one. Early intervention in kids prevents bigger problems. Myth or fact?
It's a fact.
Absolutely.
Yes, absolutely.
And reference episode 1 when we talk all about airways.
Airways in kids, pediatric sleep apnea, a lot of sleep disordered breathing issues. Again, not a blanket statement and not something that braces alone can fix or orthodontics alone can fix, but it's part of the puzzle.
All right. Last one. Orthodontic treatment improves confidence and mental health. Myth or fact?
Absolutely a fact.
Yes.
We've seen this happen. We've seen this in a lot of patients. You improve their smile, the overall personality changes, their aura changes, the way they carry themselves. It's amazing.
We've seen it in patients when you do initial records to kind of debond. They look different.
Oh.
I mean, just the glow. I can honestly, it may sound corny to say this, but the glow in their face in those pictures, the confidence, like how many times have we been in a consult when the child comes in with their parents and the child's like, I don't smile. And the parents have never heard this and their face just goes, blank. And they're like, oh my God, are you serious? Like, we're going to begin. And then, 2 years later, 18 months later, the child is just another person. They can't stop smiling. And then I would say, that is, a lot of times when we do findings, we can take specific measurements. How do you measure that? That's hard to measure.
It's hard to measure.
I would tell parents too that are like, that is tough to measure other than the emotions and the feedback. But I will tell you, when we do D-bands, that is probably one of our favorite days because the reaction from the patients it's always so amazing. I wish we could just capture that in like multiple feelings and just show others, but it's like you have to experience it yourself.
Mm-hmm, absolutely.
Cool. All right, let's get to round 2. This is going to be an interesting one. All right, fact or fiction? You have to be a teenager to get braces. This is a big one. There's a lot of confusion around this.
No, you don't have to wait till all your adult teeth come in to get braces. That's not fact. You could absolutely, I wouldn't say braces, but orthodontic interventions can begin as early as even 4 or 5-year-olds, depending on what situation is, what the condition is.
Doesn't always mean they get braces.
Does not always mean braces. Does not always mean orthodontics has been so many times just linked with braces, but there are so many other things that are done to get your jaws ready and developed to make sure that they're ready for the adult teeth to come in. So early orthodontic interventions is absolutely something that I'm a big proponent of.
And then on the flip side, It's never too late either.
It's never too late either.
How old is the oldest one, which is awesome?
It is amazing. We've had a 82-year-old get into braces.
Let me just pause there, guys. 82.
Yes.
82. And then the reason is the most beautiful reason too. Can you explain that reason that she wanted to come in?
She is an amazing person. Great dental hygiene. Her dentist is completely on board. Beautiful health of the teeth. So kudos to her. She's making sure that her dentition and teeth at this age are also being maintained.
For 82, by the way.
She looks amazing for being 82. But her reason for getting braces was that now she's seeing herself take a lot more pictures with her grandkids, and she's never smiling in those photos. And she wants to smile when she takes pictures with her grandkids.
That's her why. Isn't that beautiful? That is her why. She wants to smile and does not want to appear to be the grumpy grandparent in the photos. That's exactly what she said. So that's phenomenal. All right, let's go to the next one. If your teeth look straight, you're fine. Myth or fact?
It's not a fact. No, It's a myth. I feel like, there are a lot of times we've had patients come in, teeth are nice and straight, but then there's something deeper to it. The bite is a big thing that people ignore, and people don't know that, okay, that also needs to be corrected. Like, you can't just look at your teeth in just one jaw, or on the top and bottom jaw. They're both connected at some point. Like, you need to bite and they need to fit together. So bite and occlusion plays a very, very big important part of the role. Sometimes the teeth are straight, but you're having this wear on your teeth. You're like, okay, my teeth are straight. I've had braces, but what's happening? Why am I getting these abfractions or kind of like enamel wear or fracture lines on my teeth, and erosions happening, things happening? There's forces that need to be acting on the teeth, and we need to make sure that they're going in the particular direction. So bite plays a very important role. Of course, the health overall, there's a lot of other factors too.
Awesome. All right, this one is an interesting one. Wisdom teeth will undo your treatment. Fact or fiction?
Okay, so this is a very interesting one because I hear this a lot. It's like, oh, my wisdom teeth came in and it made my teeth all crooked because I had braces before. I'll tell you what, crooked teeth can happen in patients who don't have wisdom teeth as well.
We've seen it. So wisdom teeth are, blamed for a lot of reasons, for a lot of different things. And yes, they kind of do some things in the mouth. Sometimes they come really far back. They don't come straight. They come at an angle. They create areas where food can get stuck. It's very hard to brush in there. It's very hard as a dentist, unless you have a beautiful big mouth like Shaq and open the mouth wide enough for us to work in that back area. Shaq may have extra wisdom teeth.
Yes, he does have extra wisdom for sure. But, if it's really hard to work back there. So that's why wisdom teeth are usually recommended for extractions in most of the situations, because they can, they're not being used. They're kind of vestigial organs in our body. So they're not being used for biting and eating and chewing purposes. So if they're not doing any good, and if they are creating more harm to the teeth adjacent to them, we usually recommend extractions on wisdom teeth. That's the reason for it. But they are not the reason that your teeth are getting crowded. Absolutely. There's more to it.
You need a dentist referral to see an orthodontics. Fact or fiction?
It's a fiction. You do not need to see a dentist most of the times. Actually, I would say in our case, Gunny, I think you might be a better person to answer this. I think 90% of the patients come to us who do not even have a primary dentist, and we're the ones sending it over.
Yeah. So that's really interesting. I mean, we're not saying don't work with a dentist. Majority of the patients that come to us because, it's so interesting being in the ortho space. I feel like people come to us because there's something about their smile or an enhancement that they want to make. And then when we get them in and we realize that, man, wow, you haven't seen a dentist or gone to the dentist, and visually too, right? You can see the need for visual hygiene kind of intervention as well. We usually will send them to a dentist, get them under proper care. But no, you do not need to have a referral from a dentist to come and see us. It's a free consult anyways. It's a complimentary consultation. So you can absolutely come and see us. All right, let's do one more. Fact or fiction? Adults have missed their window. Well, obviously, if you were listening before, that's not true, but...
It's not true. It's not, There's, again, a lot of adult patients, and sometimes it's so interesting hearing this from the patients. Oh, I'm not a wild person. I don't want this for aesthetic concerns or cosmetics. It's not my reasoning. But I tell patients all the time, which we have discussed this before in this episode as well, it's not just braces or orthodontics. It's not just about straight teeth. There's so much more going into it. A lot of times, a really good referral patient, the patients that come from general dentists who have been referred to us, is to get their occlusion or bite corrected because they've been wearing down their teeth, or there's so much things happening. Their periodontal issues are becoming worse over time because their bites have not been corrected. And that's the reason that we do braces. So yes, no, there's no age limit beginning, and I guess it's like 5 to 95.
Absolutely. All right. We're almost down with a few rounds. The last few ones, I guess it gets a little bit more spicy, okay? All right. Fact or fiction, pulling teeth is almost always necessary.
The key word here is always.
Yeah.
It's not always necessary.
Yeah.
I think we're making space. Yes, we see the crowding, and depending on the age of the patient, depending on at what stage we've seen them, how much space is needed, what's the condition, how's the bite. There's so many factors. Again, there's so much that goes into diagnosing the condition that the patient comes in with to you, and then prescribing the right treatment plan. And then in the right treatment plan, if extractions are needed, let's think about it. Why are they needed? Space? How much space? Can we make space somewhere else?
Yeah.
Like, is there ways to make space rather than just pulling teeth out? So yeah, there's a lot to it. So.
All right. This one is a nice one too. Metal braces are outdated. Fact or fiction?
They're not.
No, they're not.
They're
actually
not outdated.
Some adults actually are preferring metal braces.
Absolutely. I actually have had so many patients come and ask for metal braces. Not just, the thing is, like, people are realizing the importance of orthodontics in general, I feel. It's like they know that, okay, what orthodontics bring to their life, like, we're not in a stage where people are like, oh, I'm just going to ignore myself. Like, people are becoming more aware of their understanding how much appearance or all of that plays an important role in their overall confidence and how they succeed and perform in the life. And dentition and teeth and smile play a very important role there. So they want to fix their smiles, and then they're not afraid at this point. They're like, you know what, like, if I have braces, like, people respect you if you are investing in yourself. And it's kind of like, that kind of mind thing.
Yeah, the mindset is there. You're absolutely right. All right. This is an interesting one, and I think both of us can probably tackle it, but I'd start with you. Fact or fiction, cheaper treatment gives the same result.
Cheaper in what sense? We're talking about, like, okay, are we using, like, what is it? Like, cost for the treatment and, the market value for the treatment. Again, it's independent of the treatment plan. Again, the fact remains that an accurate diagnosis and then coming up with a great treatment plan and follow up through the treatment plan is a more important aspect of what's provided and what's the treatment provided, rather than the cost. Like, cost is, again, something that's determined. And sometimes the doctors and providers, like, we have a private practice and we work together, but then there are doctors and providers who are working in a corporate setup where they
don't have control over
They have no control over the cost.
Doesn't mean they don't want to give the good results.
Correct.
As well.
Like, they still may have like really good intentions. They still want to provide good results and beautiful results to their patients. Doesn't mean that they have a say in the cost of the treatment, I guess.
And what I would say about that is, of course, financials is going to be a decision that is important, but we always say, go in there, ask all the right questions, and have a good apples to apples comparison as well. Like Dr. Sodhi was saying, we're a private practice, so we have certain standards that we hold that add to the value of the treatment. You're going to get phenomenal treatment, but is somebody there that can get you in a reasonable time if there is a pokey wire, broken bracket, anything like that? And then are you available around the clock to kind of sometimes answer questions too? So that, I would say, is really driven by the value aspect and the certain standards. I think this is an interesting one. Cheaper, majority of the time, if you say cheaper is not always better, but that's such a relative.
I think you hit the right word there, value. What's the value that you're getting out of it? Like, we've had patients, again, like, we tell all our patients, like, find the good fit for you. Like, what's a good fit for you?
And budget could be one of those.
And budget is one of them, and not something that could be ignored for majority of the patients, and not to say that you should ignore. But again, it's the overall value that's being provided in the product that's been offered.
Absolutely. All right, round 4, last round. I think you're going to really like this one. Fact or fiction, orthodontics can impact your airway and breathing.
It's a fact. It can absolutely impact. So the impact is a good word. I feel like it impacts it. There's things that we can help benefit as part of a team effort. There's a lot of things involved. We're not diagnosing sleep apnea by any means. We're not treating it by any means. We're just one of the team members for that whole, like, the holistic team for the patient that's working together to improve a patient's lifestyle. Doesn't matter what age the patient is coming from, and there's like a lot of things involved in it. Some patients, beyond a certain age, like, you need, like, if you're candidate for CPAPs or not, you're like surgical candidates or not, you need a dental appliance or not. Like, there's a lot of different factors that go into determining. It all comes to the right diagnosis and treatment planning.
You're going to really like this one. Fact or fiction, your bite affects your posture and jaw health? And this is the last question.
Absolutely. It does affect your jaw health and your overall posture and how you place. Like there's so many times we've seen patients who come in with dual bites and they're like shifting and not having a right bite. I actually recently saw an adult patient who had really beautiful, perfect occlusion with good overjet, overbite, whatever that clearance is that we need between the upper and lower front teeth. We have that clearance. We have everything that, 1 to 2 millimeters overlap and 1 to 2 millimeters gap. And then all of a sudden she would shift her jaw forward and she keeps shifting so much and so many times during the day and while sleeping that she's literally worn the front surface of her bottom teeth. So it's a jaw issue there.
Absolutely. Awesome. I think you did pretty good. Probably answered all of them right. I think probably a good score. Well, guys, I hope you guys enjoyed that. I would love for you guys to share maybe something that shocked you, something that you weren't aware of, and then share this. And then optional challenge, send this to somebody who thinks that braces are still for just teenagers. Just kind of get them to be like, hey, this is actually a myth. And then we just busted it on this episode. We'd like to close out this one. I think it was a fun one, fact or fiction. What we'll do is next week, we're going to be talking about, as Dr. Sodhi kind of hinted, specific bites. If you have this specific bites, kind of what does it look like, the pros and cons, and then what are some things that, we can do from an orthodontic point of view to get into it. So thank you guys for joining us. We'll see you guys next week.